good evening and welcome to the meeting of the Community Relations Committee. I want to call the meeting to order. Let me begin with the adoption of the minutes for January 11th, 2022. All in favor of approving the minutes, say yes.
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 Opposed, say no. So the minutes have been approved. Let's move on to the President's report, Dr. Katz.
Thank you, Dr. Pagan, for welcome to everybody. I'm glad to be part of the Community Relations Committee. We celebrated the 100,000th member for NYC Care, which was a very exciting moment. And we had two of our patients speak about how much the program meant to them. And they were there with their doctors, and it was an incredibly moving event, and it's a program that we are incredibly committed to. The board appointed Dr. Khoi Leung as the Senior Vice President for post-acute care after we lost our much-loved Dr. Maureen McCluskey to illness. Dr. Leung has done very well, serving as the interim, and will oversee all aspects of the 5 skilled nursing facilities, as well as the long-term acute care hospital. We have been delivering home test kits to all of our New York City public libraries, Queens Public Library, Brooklyn Public Library, so 27 branches of those, as well as the 14 landmark city cultural centers, so that people can test themselves. We find that it's a very successful way that people can both learn if they are COVID positive, or we know many people want to have a test prior to seeing elderly friends or relatives, or prior to seeing someone with a immunologic deficiency, and we think that's an excellent use. I know that our board member, Sally Pinero, went to see the show vans. I hope that all board members and community members go to see these amazing vans. We've developed quite a large following among homeless people who know when the vans are going to be in their neighborhood. They have a schedule. We provide clean clothing, snacks, drinks. We dress wounds. We treat hypertension. And we connect people to further medical care. And now I'm happy to announce that that also includes buprenorphine. So we can actually, for somebody who is addicted to opioids, we can bring them in the van, set them up with a virtual meeting with a psychiatrist, and begin their therapy right then and there. We are thankful to the George Link Jr. Foundation for a $75,000 grant to support the public health system's employees' emotional support program. People know how challenging this period of COVID has been for healthcare workers. And just to give people a sense of the how great the Omicron pandemic was, we texted 700,000 people during the surge to inform them that they may have been contacts with somebody who had Omicron, and teaching them what they could do in order to be able to get services such as a free room in a hotel where they could isolate, food so they wouldn't have to go out, and medical care. With that, Mr. Chair, that's my report. Thank you.
Thank you, Dr. Katz, for your report. Any questions for Dr. Katz? Okay, so let's move on to the informational items, the CAB reports. I don't know, Deb, do you?
Sure. Akantre Labarti, who is our Senior Director for Community Affairs, if you can tee it up. Sure. I know we are starting with Coney Island, Teresa Scavo.
Good evening, Chairman Nolan, if he has logged on, Dr. Katz, members of following cabs of health and hospitals, and the members of the CRC. You received the full report, so I will just highlight what I thought was informational. Coney Island Hospital was hit very hard by the latest wave of COVID. As of January 2022, Coney had 120 COVID cases. During this peak, we saw a 40% positivity rate of those being tested. As of February 15th, the positivity rate had dropped to 6%. Due to the high positivity rate in January, shortages in staffing occurred. With the help of the H&H system, Coney was able to bring in agency staffing. At that time, Coney opened a surge unit to accommodate 37 additional patients. We also worked with our sister facilities to transfer patients when necessary. January, we also welcomed the United States Department of Defense medical team. They assisted by providing staffing support in the emergency room, intensive care units, and the med-surg unit. All the employees at Coney are vaccinated, and we are working to get all to meet the booster mandate. In 2021, we provided over 87,000 COVID tests and over 67,000 vaccines. We work 7 days a week to accommodate hospital employees as well as our community. Infrastructure and equipment. Construction of the new Ruth Bader Ginsburg Hospital of H&H South Brooklyn Health Campus is 80% complete. Projected occupancy is October 2022. Coney received $17 million in fiscal year 2022 to renovate 26,000 square feet of ambulatory care space, including exam rooms, a radiology suite, plus $250,000 for neurological and cardiac equipment. We submitted requests to the Brooklyn Borough President for $15 million to renovate the 8th floor of the main building to create a comprehensive women's health service area. We also requested $9 million from the New York State Legislature to expand outpatient clinical support services on the first floor of the main building. Patient safety and satisfaction. Coney has reinitiated patient safety executive rounds, where leadership visits all clinical as well as non-clinical areas. The rounds allow for the sharing of information as well as immediate interventions or coordination upon concerns identified. This includes COVID-related issues such as PPE. The Culture of Safety Survey was performed September 13th to November 3rd, 2021. The review is underway to determine successes or where improvement is necessary. Patient safety is always paramount. In our Joint Commission guided journey, we strive to achieve zero harm by becoming a high reliability organization. The Patient Safety Department continues the Good Catch program to create an understanding of improving performance and strengthening workflow. The facility also participated in the Leapfrog survey in 2021. One item identified by the survey was medication reconciliation within 24 hours of admission. Coney was at 8% in January 21, but among all inpatient departments, it increased to 56% in December 2021. In 2021, a tool called iRound was implemented on the inpatient unit. iRound is a web-based application that allows staff to memorialize patient feedback, notify appropriate services of issues in real time, and focus on timely service recovery. To date, over 1,600 rounds have performed. The tool will soon be expanded to the emergency department and behavioral health. A performance improvement project focused on optimizing nursing communication was started on Tower 8 East. It included focused rounding with nursing and care experience team leaders, service recovery where needed, as well as follow-up calls to discharge patients. We learned and our efforts paid off with an increase in communication with the nurses. Frequent complaints. The most frequent complaint was lack of communication. Patients do not feel they completely understand their plan of care or prognosis. Several programs are in the process of being implemented to include daily rounding, nurse handoffs, whiteboard updated daily, and a doctor hotline for family or doctor communication. Issues impacting the community service by the facility, traffic and parking around the hospital proper. Hospital police have increased visibility with more patrols 7 a.m. to 4 Monday to Friday to keep travel moving in front of the hospital. In the last 30 days, hospital police have issued parking summonses, bus stop violations, and no standing violations. Hopefully that will correct the traffic problems around the hospital. Thank you.
Thank you.
Thanks,
so,
Teresa.
so much. Yeah, go ahead. Please.
Oh, okay. Yeah, thanks, Teresa. Quick question, I think on one of the conversations that we had with the board, I don't know if there's anyone from any senior leadership from the facility that can give a quick update on the existing parking arrangements at the facility. That was one of the questions that came up during the briefing that we had about a week or so ago.
Yes, good afternoon. So I'm Svetlana Lipanska, I'm the CEO at Coney Island Hospital, and I can give an update on parking. We fully are cognizant of our current parking issues, but we have a plan in place to mitigate. It will likely happen mostly when the new building opens, because there will be a garage underneath on the first floor of the new building. And we are currently working on a study to figure out how to maximize the flow of cars, both in that garage and in the spaces that we will have in the outside lots around the campus. In addition, we have an off-site lot that is being used by staff, and so we run a shuttle to the off-site lot, and we are working hard to hold on to that lot when the new building opens, which will significantly ease the flow of cars and parking around here. We're also training additional hospital police officers to issue summonses where we're doing continuous education with our staff about not blocking the path here. We also think that once the work that is happening right now in front of the facility concludes, that will ease the flow of cars around the front of the campus. Unfortunately, I have no quick solutions, but this is something that we're taking very, very seriously. We realize that we're in an area where a lot of folks drive, and it certainly has been very challenging around the campus, but we are doing everything we can to mitigate.
Thank you so much. And we have Bob Nolan join us. Bob, you want to take over the meeting?
No, why don't you continue going and I'll follow you after that,
Oh,
just so I can see where we are.
okay. Thank you so
Okay.
much for the report. And I had actually I had a question for I don't know if Dr. Katz is still on the.
I'm here.
Yeah, I didn't see you on the little square there. On this issue of lack of understanding plans of care, and do you think that's language related, or is it related to how those papers are given to patients when they're discharged? Says the most common complaint is lack of communication because patients do not feel they completely understand their plans of care and prognosis.
Yeah, I think it's an all of the above. I mean, I think that everybody who's ever been in a hospital has wondered about their, care, and right, the mix of technology and jargon language, whether it's your native language and jargon or someone else's language and jargon, leads to people, not fully understanding. So I think that it's something that we keep working on. I think that it is something that can be improved. I don't think it's unique to us or a new problem.
Thank you so much, Dr. Katz, and thank you, Teresa, for your report.
Thank you.
Let's move to the next one. I don't have the agenda in front of me, so.
Did you do Coney Island number one, Dr. Pagan?
We did
Coney
Coney
Island only.
Okay, so then why don't I call Seaview? Mr. Marino? Mr. Marino of Seaview, you're recognized to make your report. Do we have Mr. Marino? Kalisha, I'm gonna move on then.
Here.
Mr. Nolan, Mr. Boyd,
yes.
Bill Boyd would be doing Seaview. He's on the line.
I'm sorry, I can't hear you.
Okay, you can move on, Mr.
Then I'll
Let's
introduce
move
Ms.
on.
Ileana Almanzar of Segundo Belvez.
Yes, hi, good evening, everyone. Am
Good
I
evening.
to share my screen with the executive summary, or am I just reading off my points? Okay,
We can
so
see you, and you should read the highlights of the points that are on the screen now. You can read all of them, or you can read some of them. It's up to you. You've got 5 minutes.
Okay, so this report reflects the top 5 priorities that impact patient care at Belvez Gotham. The information in this report comes from a variety of sources like the healthcare professionals and patients on site. As far as COVID, the facility would need increased promotional awareness, an increase in vaccine incentives for those who do choose to be vaccinated, and all the services that aligned for long COVID symptoms. To help cultivate health equity across our community, it is a priority for us today to work towards a commitment to help improve the practices infrastructure. These are some of the infrastructures that we would like for improvement. Here you see from the first floor's lobby to the redesign in its furniture, the modernization of the lobby. In the second floor, the integration of a pediatric dental and a pediatric suite. For the third floor, we have modernized optometry suites. And then we continue on to the modernization of the radiology suites. A frontline, a workspace for the frontline workers, such as a lounge or a wellness space, and then also its exterior, a new roof, and also a point seal facade to prevent water leaks that come through the windows when it does rain at the site. Moving on to patient safety, the location needs a renovation of the pharmacy waiting area in order for it to be ADA compliant. At the moment, it is not ADA compliant. They're also asking that all bathrooms be renovated so they do become ADA compliant, because again, at the moment, they're not ADA compliant. And also the replacement of the elevators. Unfortunately for the site, most of the time, there's only one elevator working out of two elevators that is there, and that brings an issue to those individuals who truly need the elevator, like moms with strollers or anybody with a wheelchair or any disability that does not allow them to take the steps. And then for the frequent complaints that the facility is seeing, it would be maybe more technology to allow them to and make appointments with the doctors there at the facility. And then the issues that are impacting the community will just be the more need of NYPD patrol throughout the neighborhood, just so the patients who do visit the location feel safe and those who do live around the location feel safe. And then also access to healthier food options in the area in itself. And that is it for Belvez.
Thank you very much. What I noticed, of course, when I looked at your report, is that primarily in section 2, where you go on the first floor, second floor, third floor, and you continue with the modernization of the radiology suite and so on, the exterior where you talk about the new roof, these are all capital budget requests. So I wondered if you knew whether these requests actually were already submitted to the city or whether they are to be submitted to the city. And do you know the answer, or do we have anybody from your administration who would have that answer?
Reggie on the line from our administration. Reggie?
Hello, yes, good afternoon, everybody. Yes, all of the items that we have listed were already submitted.
Could you please identify yourself?
Good afternoon. My name is Reginald Fernandez. I am the Associate Director of Nursing at Belvez.
Oh, thank you very much, and delighted to meet you. So are you telling me now that all of the items here have been submitted?
Anything about the infrastructures, yes. The other things that we talked about on COVID, that's not part of those things that we have submitted for the capital budget, and the other things that she mentioned. But anything that involves in the building, we did.
Okay, can you tell me when they were submitted?
They were submitted sometime in February.
February, like last month?
Yes.
Okay, so are these new items, were any of them old items that were submitted last year?
That I'm not too sure, sir.
Okay, if you could find that out and let us know. I'm just trying to see where they are, where these projects are, so that if they're new projects just submitted now, that's one thing. If they were submitted last year or the year before, I'm just trying to get some type of timeline so that we can then do our own job and handle these and just see where they are in the system.
All right.
Okay, thank you very much.
Yeah,
Now, the patient safety area, where you talked about the ADA compliant, those are all additional capital requests, correct? And were they submitted
correct.
in the last month also?
Yes, the one in the pharmacy we did.
Oh, what do you mean you did? It's been done already?
Yeah, we submitted that on the request in February, correct, this
Oh,
year.
you've submitted the request in February. The work has not been done yet, correct?
No,
Not yet.
the work has not been done.
Okay. And what about renovating all bathrooms to be ADA compliant? Is that the same thing?
The same
They
thing.
made the request last month?
Yes.
Okay. And the elevators, I think you mentioned one was working and the other one is not working. If that's the case, that's a very dangerous situation.
Correct. Ever since the flooding that took place in the facility, the elevator has not worked.
Ileana, is this a maintenance issue where there are certain parts that are missing? Or is this a capital construction issue where there's a need for a whole new elevator? Do you know that?
I believe that this is there's a need for a whole new elevator.
Okay, but that's a decision I would think that whoever your supervisor is there, Lata Singh,
Right.
would be in a position to know whether that's been submitted or not. So we need to find that out, and we'll have to find that out
Yes.
ourselves. Again, we want to see just
Sure,
where it is so we know exactly
Mhm.
what your requests are. And when you talked about the NYPD patrol, I know where you're located. I know you're south of Lincoln Hospital. Are you asking for NYPD patrols in addition to the hospital police patrols?
I believe so. That's what the site is asking for.
Is the person who said she was the nurse who's on? Are you still on, Miss?
No, Reggie, yes. Reginald, he's still
Yes.
on.
Oh, okay. Is that your understanding that you want NYPD patrols?
Yeah, we needed that and we requested that. Correct.
Kalisha, are you on?
Yes, I am. I'm listening.
Did the issue come up earlier? Because I think a couple of hospitals raised the issue about having regular NYPD patrols along with the existing patrols done by hospital police. And I know that we did not know ourselves what the relationship was, and we were hoping somebody on this meeting would know what that was. Has that been raised at all?
We can follow up with our central staff office, who's in charge of security, and get back to you at the next meeting, Mr. Noel.
Thank you very much, because this issue I see is two issues, and I live 2 blocks from Jacoby, and on the Jacoby Hospital grounds is the 4-9 precinct. So that was something that the city bought, or perhaps to lease from Jacoby. So the 4-9 is right there, but I have to tell you, I do not know whether my own precinct makes patrols through Jacoby or whether that's really just handled by the Jacoby police that are there. So obviously we need to just find out what the protocol is, and then we can go from there.
I can tell you a little bit. First, it's Dr. Eric Way, who all the security is under. And yes, Mr. Nolan, it's as you say it is. The security of the hospitals and the clinics is meant to be the hospital police. But NYPD has always been a close partner, and if we call them, they will respond. But it's always been the responsibility of our institutional police. I did learn, and you may know this, Mr. Nolan, that at one time, all of the police at Health and Hospital were NYPD.
Yes.
That was in the 70s. And at some point, a decision was made to create a separate hospital police and to give them the responsibility of keeping our staff and patients safe.
Okay, thank you very much, Dr. Katz. Do any of the board members have any questions of Belvez?
Thanks.
If you'd like to ask a question, just let me know. Just speak up and then take over. If not, then we'll let Belvez go and we'll move on. Hearing none, I'm going to thank Belvez and thank the participants, Ms. Eliana Almanzar. And thank you so much. And we'll be coming back to you and letting you know what it is that we're able to do. So thank you so much for participating in our meeting.
Thank you so much for having us.
Thank you.
I understand now that Mr. Boyd is on. Mr. Boyd, are you there? Mr. Boyd representing Seaview.
Mr. Boyd's not on, Mr. Nolan, but we can move forward and have Beverly Johnson present.
Okay, so we'll
on
do
behalf of
Morrisania first. Do we have Representative Beverly Johnson of Morrisania? Ms. Johnson,
Yes.
are you on our meeting?
I am.
Oh, thank you so much for being on our meeting, Ms. Johnson. And you go ahead, you got 5 minutes to prepare your report on Morrisania.
Thank you. Good evening, everyone. Gotham Health Morrisania Executive Cab Report, March 2022.
Excuse me, can you speak a little louder?
Sure. Gotham Health Morrisania Executive Cab Report, March 2022. Beverly Johnson, Chair, Community Advisory Board. COVID-19, Gotham Health. Morrisania has tested over 44,803 patients and vaccinated 23,741 since the beginning of the pandemic. The clinical team provides patients with the most updated information about the pandemic and educates them on the importance of getting tested and vaccinated. Physical plant equipment. We continue to upgrade equipment as necessary to ensure that staff is equipped to perform their jobs effectively and efficiently. Partnered with patients, staff, and community members, the Illumination Fund and Arts in Medicine program to create and paint a mural for our pediatrics unit. The garden committee has been upgrading and managing our courtyard garden to create a healing space for staff and patients during the spring, summer, and fall months. Installed temporary sneeze guards throughout the building to protect both staff and patients. Complaints. Most frequent reasons for patient complaints include waiting time and getting through to call center. Community issues. Community members request an OBGYN and Spanish-speaking provider in adult medicine. Community outreach. Community Affairs has distributed over 7,000 flyers to community residents, NYCHA, small businesses, and community partners on the importance of getting COVID-19 tests and COVID-19 vaccine.
Okay, Ms. Johnson, is that the end of your report?
Yes, sir.
Thank you very much for presenting the report. Could you go into a little more detail on your request under community issues? Seems like you're requesting a doctor, an OBGYN doctor who also speaks Spanish to work in that area of adult medicine. Is that the case? I want to understand. I want the board members to understand exactly what it is that Morrisania is saying that they need.
I don't know. It was my understanding that Mrs. Santos would answer.
Oh, I see. Okay. Is Ms. Santos on the line? Is that Joaquin Santos, Deputy Director of Ambulatory Care? Do we have a Mr. Santos on the line from Morrisania?
No, Mr. Nolan. Mr. Santos is
Okay.
not on the line.
So we don't. Ms. Johnson, can I ask you how many members are on the advisory board at Morrisania, to the best of your knowledge?
What was the question? I'm sorry.
How many members are on the advisory board with you on the CAB at Morrisania?
There's 3 others.
Okay, so there needs to be, because this issue has come up before, an effort. I will reach out to our new borough president, the borough president Gibson, who I think represented part of the Morrisania area. In fact, I think her office was right by the hospital, and talk to her office about seeing if some of the people who apply for the community board would also be interested in applying to serve on the community advisory board of the hospital. And that would certainly make your job a lot easier.
Mr. Nolan, this is Deb Brown. Thank you so much for doing that.
Hi,
We've
Deborah,
actually
how are you?
I'm well, thank you. How are you?
Go ahead.
We've actually reached out to borough president and in fact, all of the borough presidents to let them know, as many of them come into office, just the point you just made, that the community board appointments, the community advisory board appointments are within their powers to set up some time to talk to them about it. So we would absolutely love your continued support on that, but I just did want you to know we'd laid those seeds as well.
Thank you very much, Deborah, for updating me on that. But I know that you're right, because I got an email from the Bronx Borough President's office giving me the information, I think, that about the number of appointments that the borough president had, that the hospital. So you're on the ball and you're on top of that already, and I appreciate that. And you're reminding me that you did that at least a month ago to get in early with the borough president to see if they can help you with that process. So thank you
They're
so much,
excellent
Deborah.
partners, of
Okay,
course,
well,
and
that's
we
good.
thank them.
Thank you so much. Ms. Johnson, I appreciate your report. I'd like to ask if any of the sitting board members of the committee would have any questions of Ms. Johnson concerning her report.
No.
Hearing none, Ms. Johnson, thank you so much for your report, and we appreciate that from Morrisania. Now we're going to move back and just to get Seaview. Well, updates, we kind of updates. Mr. Boyd, who was going to speak to Seaview, is unable to join our meeting now. And I am informed we're going to see the report at our next meeting, which should be on around the first week in May. And that's the update report, Kalisha, correct?
Yes.
Yes. So I understand, since I missed the beginning, that somehow I was in technological purgatory and unable to get through anywhere, but somehow I was rescued by the wonderful staff downtown. I want to thank Kalisha and Janny and Tiffany and whoever else helped to rescue me up here. But I want to thank our chair, Jose Pagan, Sally, my partner here in the Bronx, our wonderful
Bob?
president. Yes?
Bob, I just wanted to mention something if I can.
Oh, go right ahead, Sally.
Oh, okay, thank
I
you.
wanted to introduce really who was on, in case that wasn't done. Dr. Katz, then Anita is on, also Dr. Marthone, one of our newest members who represents Brooklyn. I recognize Sally Pinheiro.
Thank you. Actually, I'm sorry I didn't mention this before. Some of the CAB members present left. I just wanted to share that a personal anecdote. We attended my dad's birthday party. He was 97, and
Oh,
he
God
wasn't.
bless him.
Thank you. He wasn't feeling. He had like a cold. So at the end of the birthday party, we did a COVID test, and he was positive. And I remembered the press briefing we had that discussed the availability of at-home medication for certain populations. But I touched base with Dr. Katz to refresh my memory. And so then I called the hotline, and they very kindly took me through a question process where they determined that, which included my father's medications, and determined that they were contraindicated with the Pfizer medication. So subsequently, my father had to get an IV infusion. But I mentioned that all to say that I know that H&H is and DOH are now working on spreading the word that this Pfizer medication is available. It's more widely available than originally was thought it would be. And so it would be useful for the CAB chairs to share that information with their members. Yeah, I don't know if you have any questions of me, but that generally is what I wanted to say.
Sally, I think one of the other things that's interesting about your experience is you called our virtual emergency room. And your experience has nothing to do with who you are. They had no idea, right? You were just calling our generic line. No arrangements were made. You simply called as an average person. And it sounds like you got great service.
They did. There was a pre-screening process and where they gathered certain information, and then I was connected with a doctor who spoke to my father and got additional information. They were extremely helpful and very soothing.
The reason I raise it is, in some ways, that's a long-lasting change that COVID brought. We didn't obviously have a virtual emergency department 2 years ago that anybody could just call and get a consultation. And the number wasn't specific to COVID. They would have helped your father if he was calling because of abdominal pain or a bad headache, right? You would have gotten for him the same service. And it's one of the things that I think will be a lasting improvement in terms of access, that anybody, especially a homebound person, can now access health and hospital from their telephone or laptop and get medical advice in real time from a physician. I think it's a very exciting thing.
Absolutely.
Thank you so much, Sally, for sharing that with us. Dr. Pagan, did you have a chance to adopt the minutes at the beginning of the meeting?
Yes, yes, we did.
Okay, were you able to announce the hearings coming up in March and April, May and June of the public hearings that the board holds?
No, I didn't. Go ahead.
Okay, I'm just going to quickly mention Tuesday, March 5th, will be on Staten Island at 6 o'clock at Seaview for anybody from Staten Island who wants to testify. And on Tuesday, April 5th, we'll be in Manhattan at Gouverneur at 6 o'clock. And I will mention one more, and we'll be in Queens on Tuesday, May the 10th at 6 o'clock at Queens Hospital. The Bronx hearing will be held in May also at Lincoln, and Brooklyn will be held June 14th at Coney Island, but we'll have our next meeting in early May, so we can give you that information in greater detail at that point. I see what time it is. It's almost 5 minutes of 6. I know there's a community advisory board meeting that will follow. So is there any other old business that anybody would like to bring up or any new business? Hearing none, I declare this meeting adjourned. Thank you very much for participating and being here in time and presenting excellent reports.
Thank you very much.
Thank you.
Goodbye.
Bye.
Bye, Sally.
Bye.
Thank you, Jenny. Thank you, David.
Thank you.